This is Dr. Narendrakumar from Chennai. We'll be demonstrating a interesting case of an endoscopic drainage for a septal hematoma patient. Patient presented with severe nasal block following injury to the nose, and this is the CT scan shows a septal hematoma which obscuring her airway. On diagnostic nasal endoscopy, you can see that yielding of the septum. So we started the surgery by giving infiltration on both sides of the nasal septum, and wide bore needle is used to check the content, and it's a hematoma. You can see it is making the right side to decompress. 3 to 5 ml of blood has been aspirated. This is aspirating the hematoma from the opposite side. Is this is enough? No. So we have to make sure that the collection should not be repeated. So we made a fierce incision and we could see the septal hematoma, the clotted blood and retained blood secretions post injury has been sucked out, and we are just elevating the flap, and the cartilage part is also affected. So that's the reason we plan for a septoplasty to make sure that the infected cartilage has to be removed, and thereby a complete drainage of the hematoma, which will make sure that avoidance of the recurrence of collection of fluid. You can see the septal spur which is there. So slowly we are elevating it, aspirating. You can see the septal spur here. Aspirating the hematoma is sure it is not enough, and we have to remove the part of the cartilage which is enough, but in this case we did a septoplasty to give a good breathing for the patient. So the anterior part of the septum, which was more affected, has been removed. This will make sure that not only the hematoma is drained, the recurrence rate will be very less, and the patient will have a very good nasal breathing. So these cartilages are all removed. Is that end of the surgery? No. The main part in septal hematoma is intentionally we have to make sure that we have to create a septal window. So we make sure that one side of the mucosal flap we have to make a window, and make sure that we are not injuring the corresponding opposite side of the flap to avoid septal perforation in near future. So make a small nick. This is useful for further drainage of the hematoma if collected. So a thorough wash is given. The septal spur is gone on the opposite side. So make a suture of it, and that's the end of the surgery. Thank you one and all for watching this video. Thank you all.